The cubital fossa, a vital passageway. Function. The cubital fossa, also known as the antecubital fossa, is a triangular-shaped depression on the anterior aspect of the elbow joint. Its primary function is to serve as a passageway for crucial structures, including nerves, blood vessels, and tendons, as they transition from the upper arm to the forearm. Contents. The cubital fossa houses several important structures: the median nerve, which controls sensation and movement in the hand, the brachial artery, the main blood supply to the arm, the biceps tendon, which connects the biceps muscle to the forearm, and the radial nerve, which controls sensation and movement in the forearm and hand. Clinical significance. The cubital fossa is a vital area for medical procedures due to the accessibility of its blood vessels. Common procedures performed in this region include venipuncture, which is drawing blood for tests, intravenous catheter insertion for administering fluids or medications, and arteriovenous fistula creation, which is essential for hemodialysis patients. Types of veins in the cubital fossa. While there are no specific types of the cubital fossa itself, the veins within it are categorized based on their arrangement. Type 1. The median antebrachial vein is dominant and connects to both the cephalic and basilic veins. Type 2. The median cubital vein is the main connection between the cephalic and basilic veins. Type 3. The brachial cephalic vein is underdeveloped or absent. Understanding these vein variations is crucial for successful venipuncture and other procedures. Would you like to learn more about a specific aspect of the cubital fossa, such as its boundaries, clinical conditions affecting it, or the procedures performed in this area?